Yeah, you are on.
Yeah, yeah. So, hello, Dr. Rupal Shah. I'm so glad and happy that you've accepted my invitation to come and share your journey with me about your books that you have written, The Magnificent Plants. And the reason why I really wish to have you and talk with you and know lots about it is because what I know is that this uh, the books you have written nearly a decade ago, which is like in the year 1999, and that was the time where I think we knew as students, the remedies only in terms of materia medica. Not much of source was known, and we just had some kind of a little idea about Dr. Jan Scholten when he introduced the periodic table, where we learned minerals in that way. But plants were really not gone so deep in the understanding in terms of source level. And so for me to know that you did that kind of work in those times, like 10 years back, and getting into every
20
uh,
years,
re-
Aradhana.
20 years. Oh, okay, 20 years
1999.
back, huh?
That
Okay.
century.
Yeah, seriously, it's 20 years back. Yeah. I think I missed that. And I mean, now it's still more to know that at that time, getting into every remedy, into the source, understanding through the the orders, the families, and then and the kind of detailed symptomatology that you have given of every remedy is just it's really amazing work done. I can only say that. And also my quest of knowing it was more because I remember I had a case, and yes, I did arrive to the Malvale's family, but I wasn't and I was very close to certain remedies of Malvale's, of chocolate, Abel Moscus, and I was trying to get info about each of their materia medica. To be very frank, yes, chocolate, yes, lot of books do mention, but if you actually see Abel Moscus, hardly any info, neither in Boric nor Fatux, neither in the Allens, neither
The
Herrick.
common
I
books,
didn't
yeah.
get any info. Yeah, these are the books we usually refer for, most of even the uncommon ones. And
Mm.
then and I saw your book, and the way the symptomatology, the detailed description was so good, and actually I could actually differentiate what my patient was saying, and I happened to give her Abel Moscus, and such a beautiful result. And I think if I
Well,
didn't go through your book, I wouldn't. I mean, if I had to give chocolate, obviously it wouldn't have worked. And knowing it, the confidence level obviously improves, because in the end, yes, source is there, but you also need to see the sphere of action and the symptomatology. And there your work is amazing. And many, in fact, many a times I first tend to have a peep when I'm going through my Mac repertory. First peep is to your book, see that
wow.
detailed, I would say even a concise description of the symptomatology, and then I do have a peep in most of my cases. So that is where my urge to know more than how so many years back, when there was no info available, not many books, how did you even think of getting, writing something, going into this era of writing a book? So if you could share this, it would be my pleasure.
Yeah, so as you know, Aradhana, there are two books that we've written on plant as per the botanical families as a group. That time, the study of remedies in groups was taking shape. It was the beginning of era of understanding the patterns of remedies through their groups, like the Jan Scholten's periodic table work. That was the epitome that time, and it was the most that time confusing though, but very useful later on type of work, which now after 20 years we feel it's the bible of understanding remedies, because that's how Jan Scholten paved the way for studying in groups and seeing patterns in things. And in botany I was wondering, I mean in but plant remedies I was wondering how will we ever know this. Materia medica was kind of just therapeutics and just memorizing, and it never made any sense. I mean, being a doctor, you felt materia medica was the last subject to grasp, because you couldn't see anything. You can check the pulse, you can see the blood pressure, but here materia medica of any remedy for that matter, was just imagine symptoms and remember symptoms, and it was not forming a picture kind, as the portrait was supposed to be made in our Hahnemann's description, that understand the portrait of the disease, but portrait of the remedy was also not clear. So forget, then we developed the whole system of understanding in group and understanding the pattern, and the whole picture was formed, and that picture we were matching with the picture of the remedy and the case, vice versa. So that became more useful, and then longer lasting and better, deeper results we could get. And that is what we grasped with Dr. Sankaran's sessions, in garden sessions, Wednesday garden sessions we would have, and there he would talk about the mind part and the delusion part, and that's how we got into more into understanding the mind. But mind was still not completely understood till we understand Dr. Mahesh Gandhi's way of development, and seeing the psychosocial part of the development of a human psyche, and the remedies. That is how the whole journey was, and it got really really very useful now with this understanding of a fellowship of that the fellowship that we did in homeopathy, psychiatry and counseling. Now
Yeah,
it all
yeah.
makes all the
This
more
is like,
sense.
yeah. So, but yeah, the things have come together now. But
Yeah.
at that time, 20 years
Yes.
back, when you started with this source, so I want to know your journey basically. How
Right.
did you do it? Like, what made you go through,
Yes.
and you ultimately published books? And how did
Yeah.
you go through when there was no info available? I want to know your journey of
I
that
can say,
time.
like,
How did you go through?
like China, how China was for Honeyman, like Sincona Bach's study as a chemist, it made him go into homeopathy. That's how studying Coffea cruda, like from botany point of view, also decided our journey into plant remedies, and then forming a book and then publishing a book till that time. Because I started studying a little bit about with my group of junior doctors who were coming to assist, as well as they were very keen and enthusiastic to learn. So they said, let us study something, so do some common things. So we said, okay, we'll study each and every family one by one, and see if that helps understanding plants in a better way. Because that was so, there are so many remedies from plant source, but we didn't really have confidence of prescribing, except the few polycrest like bryonia
Yeah,
and a little bit of pulsatilla, and all those were the only few remedies. And I knew there are so many remedies in our materia medica. So that way, when we started reading families one by one, we could actually see their common thread and the beautiful understanding arriving only by studying the group, that particular botanical family. If you see Naxomica ignatia gelsemium together, you realize, oh my god, they are all acting on the spinal reflex action, and they all have paralysis at the end, exhaustion at the end, there is excitement. So like how opium and chelidonium are so close, liver remedies and fears of dead body and dreams of dead bodies. So we realize that Stramonium, hyoscyamus, belladonna are of the same family, and no wonder they are so close. So everything got more and more interesting and more dynamic as we did it. And after 10-15 families that we studied together, and the notes that we made, we everyone used to read from different books and get the info together. So whatever info they got, we got, and then we made understanding at the end of it. And then we said, we'll show it to our teachers. Maybe they will be interested in giving their reviews or understand, or maybe publish it at the end. But we realized that we were there and there were no takers, kind of. Nobody was even interested in knowing what we are doing, because it was maybe before, too much before the time, kind of a thing. But then we said, okay. Then Dr. Shankaran read it and he said, okay, I'll write a foreword for you that time. So when he agreed to write a foreword, we said, okay, now we are going to go on. We are not going to stop here. So we compiled everything and made it into a book form. And he wrote a foreword. And in that time, during that time only, Jan Scholten was visiting India to talk on his book, his work on periodic table. And we gave him a rough copy of like the first and print out of our work, and just told him that please go over in your 1 day break that you have, and then we'll meet up or maybe talk about it. So after finishing the seminar, when we went to him saying, how did you like it, or how is the work, he said, oh my god, who did this work? And he was so amazed, and he said, wow, it's an excellent work and I'm very happy, and keep it up and go on. And that was the last thing. Then we said, no, okay, we'll publish it with our own money, in our own way, whatever little we understand of publishing and compiling everything we understood. And we did it, and then we said, no, we are going to publish it. And it happened to be same year or same time when there was a big seminar happening in Birla Sabhagru, and the homeopathy research and charities seminar was there, and sir was to speak on that day about plants, little bit about plants and families, and we are kind of setting up a stall outside the auditorium with our books, and like it did a magic. So many books were kind of sold, and people got so interested, and it kind of sold like a hot cake, like, fresh from the oven, and everyone was so happy to know.
And you have also to tell me how did it reach David Watkins, the Mac
Right.
repertory. That
Yeah,
I
yeah.
think was also
Yeah, it was a big
a great
milestone.
step stone. Yeah,
Absolutely,
yeah,
absolutely. When we were working and this book was being, it was in the pipeline, and of that time David Watkins was visiting Dr. Sankaran, and I was assisting Dr. Sankaran too that time. So we were doing a teachers training course with Dr. Sankaran in homeopathic research and charities. So that teachers training course is where 15 days we kind of do every day, learn a lot of cases, and that time David was also there on one of the days, and he said that he's coming up with this kind of software. That time software was also a big thing, but it was very
yes.
interesting, and we got to see the software and understood little bit about it. So I at the end of 1 or 2 years I offered him our books, and he said, oh, this is very good, I would surely like to add it, because he was very open minded and he wanted to incorporate as much as possible in his software. So he himself kind of gave us a option that either we give the books to him and he gives us his software, or copyright issue we discussed. But we said we were very happy to barter for the software that he was also preparing, and that's how he incorporated it in his own way, in a little different way. That time he has incorporated it as a Desai's books on plants, or Desai's magnificent plants, something like that. He has not given the whole name, but it is the same books that we have published, re-exploring our magnificent plants. And that time my surname was Desai, so it is Desai's books, not as
Yeah.
Rupal Shah, and that's how it is there now
Okay.
also.
Yeah, it's great to have your book there, because now it's more at the tip of your finger. You have a
Yeah,
Mac report. You open up and you can read the book. So that's how it's
exactly.
becoming. It's very very handy
Yes.
for us having it there. So
Rather that time people were using books more, and our time software was less popular, like 10, 20 years ago. So that time people were actually interested in the books, and they were really going out of their way, ordering books, and paying, ready to pay kind of. So that way the books are also very useful, and it has got little easier way to go through. Here it is divided in chapters, and some information is not
yeah,
exactly
true.
in the flow, but in the book there is a understanding of the whole family, then there are all the remedies described, and that is the whole flow. And at the end of the book we have given a whole chart to how to reach the right family. There we have given some
Oh,
shortcuts.
lovely.
So all those topics also are included in the book, which you can, if you read, you get a better idea. But still in software it becomes easy to use it in day to day practice and get the information about
And
the
is
remedies.
there anything any of your upcoming work that you are planning
So
now?
now being with all these like keen doctors like you all, and practitioners of psychiatry also, they've given me the impetus to work more, or come up with the next edition, because we are almost exhausted with our books and our edition is kind of over. So they said, no, you should get out with a new edition. So we are working and planning to have a new avatar of the book, or maybe something totally new, but on plants, of course.
Oh, that'll be great. Actually, we are all would be looking forward to it. Your earlier books itself have been helpful, and especially knowing that the enthusiasm you had to even to think that you are going to write a book and publish it in those
It
times.
was not easy,
This
true.
this yes, I'm sure it's not easy, and I hope it is. And for me, I was in awe to know that you have written this so many years back. The work which now we are waiting and eager to get info, it's already there, and you've done it, and.
Yeah.
And hope this also inspires our younger doctors to
Yes.
have that kind of an enthu in them to do something more. But yes, your work has
Yeah,
been
yeah.
amazing.
Lot of PG students have been now, after that, after the post-graduation came up in homeopathy, a lot of doctors doing PG in Materia Medica are finding it very useful. And they are saying that we are referring it as a Bible of plant remedies. So I was very, very
Oh, wow.
happy to hear this kind of
Yeah,
uh,
I know all
remarks.
your work your contribution has been great, and I really, and those who don't know, I mean, if this information reaches people, and those who don't know, it's really a very beautiful book, and you will get a lot of information on most of the rare plants with the complete info and detailed
Family
materia
studies.
medica on it.
Yeah, yeah.
So,
Though we had a lot of
so
difficulties also that time because this was like printing. Proofreading can go on and on and on forever. You know, we can keep on correcting and improvising and still find difficulties and still find a lot of mistakes. So I'm sure there must be still some mistakes left, but we have tried to do maximum proofreading, and the information is as correct and precise as possible. We have tried, but in the newer version, even those shortcomings will also be addressed. Yeah. Are we back
yeah,
now?
so
Proper?
yeah.
Yeah.
So, Dr. Rupal, the last one more question I
Yeah.
had is that could you just also, as you said, that in the Mac repertory, yes, your accessibility is easier, but we will just get in short a little idea. But could you tell me that in your book, how have you? What is the layout or the format, of in the entire book? Which, like, it could be easy for the beginners or for the practitioners. What exact information would it offer, so that it
Yeah.
makes them
So
sense
the
to get there?
whole idea of making it in a book form was that only that if we input all the information of one plant family in one place from different books and different sources, like including even folklores or even botanical information or even biochemistry. Some plants have very specific, like hydrocyanic acid, or all of rosaceae family have lot of information based on the chemical composition of hydrocyanic acid being the main active principle. So then, be it almond or be it strawberry or be it rose, we can think of this family when we know the action that it causes heart problems, it causes cyanosis, it causes a lot of choking and all those feelings of circulatory system. So that's how, when we study the remedy as a whole from all these different sources plus as a group, bigger group of a botanical thing, then the whole idea becomes very clear. Firstly, you understand the whole remedy and the family very, very beautifully and clearly, like a live materia medica, so that it is easy to find in cases or easy to correlate with cases, because cases are live pictures. We have to correlate with the life of the patient. So that's where it is easy. Plus, secondly, in our book, the idea is to give all the remedies also in detail of the same family, because in one place at same time, if you read all the remedies of the group, you can start seeing why dalkamara has quarrelsomeness without anger, or why there is so much of anger, violence in belladonna, hyoscyamus tremonium all together. Because then we know that, okay, when these are the prominent features or these are the things, sphere of action that you see, you can think of a particular family or particular group of remedies. Then it becomes very easy to come down or narrow down, and then just think of or find out the details, as you said, abel moscus and chocolate, how they differentiate. You differentiate those capsicum from say solanum tuberosum, and then it becomes quicker and faster. So that's the whole thing. And in the book format also, that's why we have given the books the remedies in detail plus their understanding at the end of it.
So
And in the
basically,
end of
even
the
you have.
chapter, Aradhana, the end of the book, there is
Huh.
a whole chapter on reaching the road to reach the right family also. So,
Oh, okay.
how to reach the right family from just different angles I've given. Like emotional issues are common, then it will be like these families. There is more intellectual and brain fact, and these are the families. So that's how also you can reach and think of a family instead of just going by
Oh,
symptoms.
okay. So you have incorporated, you mean to say, even the active principle of every plant
Understanding.
in that manner,
Yes.
the understanding of that, and then how
Action.
it is
Yeah.
seen in the symptomatology form, and the
Right.
two, the how they both come together, And then you
Yes.
have the symptomatology, the materia medica, depending on the active
Yeah, even
principle and
botanical
what the seed.
information, some botanical information, like that a whole composite is group of so many flowers on one disc and forming small flowers, but completely well formed structure of a plant, of a flower, which is very interesting to understand the psychology, like how Yakir now explains that it is useful as a very specific, well identified structure of a person. Like mind also will be very well structured, well formed, very well defined in composite. So that will information of exchange of all this information will make it more reliable and more confident in prescribing.
And reading Yakir, I know that she has mentioned your book in
Oh,
many places
true.
of her, and
Yeah,
and the good one aspect which I personally feel is that your book is quite cost effective too. With respect to the other books, and you have kind of simplified it in a very beautiful way, where it's easy to understand and get the idea even for beginners, not just
correct.
people who have an idea of the sensation or have the idea of the PEM evolution method. But I think your book is also very good, for the beginners especially, where they just need
Want
to
to
have the
understand, yeah.
initial understanding, and that gives them a really good idea. So
And they better get an
uh,
access to this way also of learning remedies and making it more
yes,
useful in
yes,
practice,
yes,
because we are missing out a lot
yes,
of
yes.
families and a lot of remedies if we don't know the
Yes,
concept.
true. This is what I also, while studying, as I said, while studying families, there are very rare remedies which you don't have info, but the way you have given information is very useful. It has been for me, and I hope that those who read your book now probably would be of a great help. And it is indeed a treasure to have your book in our library. So I am very
Thank you.
thankful to you. I'm really thankful to you for the great effort, the great contribution you have made, and it's a breakthrough for us homeopaths, and really
We are
great
very
talking and
happy.
knowing about
Hmm.
all your struggles, your ups and downs that you did years back, and gave us a very smooth platform of all the information. So thank you so much, Dr. Rupal.
Yeah,
Thanks
Radha, I'm
for
happy if people can use it and further enhance their practice and understanding of materia medica, and it makes it interesting for them. That is what humbles us in working out all this.
yeah, it's so
Yeah.
nice of you. Okay,
Thank you very
so
much.
thank you so much. Yeah, thanks,
Yeah,
Dr.
bye.
Rupal.
Thank you.
Bye. Bye.
Aradhana, you are yourself a big homeopath now, as we know the kind of work you are doing and the kind of teaching, the lessons, I mean the lectures that you are giving, and I hope you continue your work also with all the support from us is always there, and all the best to
My
you and
pleasure.
homeopathy.
My pleasure. Thank you so much.
Yeah, bye.
Yeah, okay. Bye.
Yeah.